Well, good afternoon, everyone, and welcome to today's webinar, Open Notes, a Key to Patient Engagement. My name is Brandy Johns, and I'm the Training and Development Manager for the Nevada Primary Care Association. Before we get started, I'd like to go over a few items so you know how to participate in today's event. During the presentation, please make sure to mute your phone or computer so that we don't have feedback or background noise. Also, please be sure not to put your phone on hold or we will hear your hold music. Today's session will be recorded and available on our website by next week. You will have the opportunity to submit your questions to today's presenter by typing your questions into the chat pane on the control panel. You may send your questions in at any time during the presentation, and we will have time at the end of the session for questions. At the end of the session, you'll be sent a quick evaluation. We greatly appreciate your feedback. Today, we will be hearing from Dr. Homer Chin. As a member of the Open Notes team, Dr. Chin works with the electronic health record vendors to implement functionality that supports note sharing between clinicians and patients. He is an affiliate professor in the Department of Medical Informatics and Outcomes Research at the Oregon Health and Science University and a member of the board of OCHIN, a non-for-profit organization that provides information and management services to safety net clinics in support of the medically underserved. Before his recent retirement from administration in 2013, Dr. Chin was the Associate Medical Director for Medical Informatics at Kaiser Permanente Northwest. He has received his medical degree from Dartmouth Medical School and completed an academic fellowship in medical informatics at Stanford University before joining Kaiser Permanente, where he pioneered efforts to implement an award-winning comprehensive outpatient computer-based patient record at Kaiser Permanente. We will also be hearing from Amy Fellows. Amy is involved in the vulnerable population and vendor strategies for furthering the spread of Open Notes nationally. Amy is the Executive Director of We Can Do Better, a Portland, Oregon-based nonprofit with the mission to create opportunities for nonpartisan civic education and engagement, bringing people together who share the values of better healthcare and health for all. Before we start, we have a few poll questions for you if you can participate in them. I'm going to put that on there now. So it looks like we are about split, 50% yes and 50% no on those who've heard about Open Notes. This is, have you ever viewed your own or a family member's notes? Looks like we have about 75% yes and 25% no. And for our last poll question, what EHR does your clinic use? All right, it looks like we're about 50% on NextGen and 50% on eClinicWorks. Thank you for filling those out.
Hi, this is Amy, and while Dr. Chin is getting unmuted, then maybe I'll just get us started and he can take over. So this is what we're going to cover today. Open Notes, what is it? Experience and effects, implementation nationally in terms of other FQHCs and within Nevada, Open Notes in the medically underserved, and lessons learned, advice, and then any questions you all might have. Next slide. So what is Open Notes? Open Notes is an initiative to give patients access to their medical providers' notes via secure patient portals. It is not a vendor product or software. You'll see that very boldly in the third bullet. It is using patient portals as the means to provide the note, and it is a national movement that's dedicated to making healthcare more open and transparent. And for the last few years, it has been funded by the 4 organizations that you see below. It is a fully philanthropically funded movement that is housed at Beth Israel Deaconess Medical Center in Boston, Massachusetts. But it is funded by the Robert Wood Johnson Foundation, Gordon Betty Moore Foundation, Peterson Foundation, and Cambria Health Foundation, which is a Northwest Blue Cross Blue Shield affiliate. Next slide. So the original study occurred in 2010. The idea was to share the patient's EHR visit note with the patient through secure patient portals. And it was originally done at 3 very different sites. Beth Israel Deaconess Medical Center, which has had and still has a homegrown system. Geisinger in Boston, Geisinger in rural Pennsylvania, and I believe they had Epic when they started, and Seattle Safety Net Hospital Harborview, which has outpatient clinics with more of kind of a FQHC type clientele, Medicaid and uninsured primarily. So these were the original research findings and have pretty consistently held up over time from groups that we have talked to as this movement has spread across the country. So these were kind of the three things they looked at. Were visits significantly longer? Was more time addressing patients' questions outside of visits? And would it take more time to write, edit, or dictate notes? And those were the things that providers were concerned about. And so you'll see the percent expectations of the providers that were participating in the study that they thought 24% of them thought that it would visits would take longer, but in fact only 2% is only the case 2% of the time. More time addressing patient questions outside of visits, also only 3%, so that expectation was not met. And the more time writing, editing, and dictating notes also was much lower than they expected.
Hello.
Hi,
hi,
there's
Amy.
Dr. Chen. Yep,
Yeah,
I'll let
hi.
you take over the next slide unless you have something to say, more to say about this one.
Yeah, no, I'll say a little more about this one. Sorry, I apologize about the technical issues. The best laid plans sometimes don't work out, so appreciate that. Can you hear me okay? Because I've got two different phones I could use, and this is one.
Yeah, we can hear you great.
Okay, great. So one of the things about this slide is, you know, when they asked, are visits significantly longer, the expectations were 24% said yes before the study was done, and then after experiencing OpenNotes for a year, they asked them again, and 2% said yes, visits were significantly longer. But the interesting thing is they didn't ask whether visits were shorter, and there's reasonable evidence now that actually with patients as engaged as they are with OpenNotes, that visits could be shorter. And we've got some slides later on that will support that. And then in terms of more time addressing patient questions outside of visits, 40% felt that they might be spending more time. And then after the intervention, 3% said that they were spending more time. But again, they didn't ask, are you spending less time answering questions outside of visits? And there is evidence that actually physicians are spending less time now that patients have access to the note. And then in terms of more time writing and editing, dictating notes, the predominant thing that we hear is that some clinicians say that they change the way that they write their notes, realizing that patients might be accessing them, but it doesn't take them more time. So overall, the expectations and worries that people had were not founded. In the next slide, we can see the benefits that patients report. So about 3/4 of patients reported all these benefits: taking better care of themselves, a better understanding of their medical conditions, remembering the plan of their care, being better prepared for visits, being more in control of their care, and doing better with taking medications as prescribed. So these are the benefits. You know, there are potentially a few side effects, but these are the very significant benefits. And what we point to is whether the benefits outweigh the risks, and our sense is the benefits far outweigh the downside. In the next slide, at the end of this 12-month study, 99% of patients wanted to continue to see their notes. 85% said the availability of this would affect their future choice of providers. Not one of the doctors dropped out of the after stopped at the end, and the 3 institutions decided to expand the practice widely. And so with that evidence, the OpenNotes kind of movement got started, and it's starting to roll across, I would say, the U.S. and we can show you data about that in subsequent slides. On the next slide, our sense is that there is a patient safety aspect to this as well that's difficult to capture in these surveys in this quantitative way. But in the next slide, we see some of the reports that we're getting from patients that point out the potential improvement in patient safety. So delayed diagnosis. If this had been available years ago, I've just had my breast cancer diagnosed earlier. A doctor wrote in my chart and marked the exact area but never informed me. Medication errors, patients will pick those up. Adherence to follow-up. Weeks after my visit, I thought, wasn't I supposed to look into something? I went online and saw that there was a precancerous skin lesion my doctor wanted me to have removed. And so given that she was able to see the note, she went ahead and did that. For caregivers that are caring for patients, it's much easier to access information, and this is something that we hear over and over again, that for the family member of patients who are monitoring what's going on, the patient finds the notes more accurate and an easier way to share the status of their health with their patients. And that's something we hear from physicians as well. Physicians that take care of sick patients often will see their patients and then will get numerous calls from family members wanting to know what's happening. And what they're saying is that when the family member has access to the note itself, they they spend much less time on those calls with the other family members because everybody's on the same page. And then more eyes on the chart, that's a comment from a physician. I felt my care was safer as they knew that patients would be able to update me if I didn't get it right and were looking at their own medical record. The next slide shows some additional data. So in terms of the benefits that were experienced and the extent of the worries, we now have somewhere close to 200 organizations that have implemented OpenNotes, giving patients access to their visit notes. And what we hear over and over again is confirmation of the earlier study. Number one is, does seeing your note allow you to take better care of yourself? And again, predominantly 85% yes and 15% no. How much of what was in the note did you understand? So that's a concern that physicians have, is that the note is written in kind of doctor speak and the patients wouldn't understand it and they'd be confused about it. But 60% said they understood all of it, 30% most of it, and there were a small percentage that said they didn't understand any of it. But those percentages are fairly small. On the next slide, the other thing that physicians are concerned about is that patients are going to be more confused and worried when they see the note. And certainly in this study, about 5% said, yes, reading the note made me more worried. But what's interesting is that a large percentage, 40%, said that reading the note made them less worried. So they might have been concerned about something, but when they read the note, it really clarified the situation, and so it made them less worried. And in terms of contacting the provider, yes, a certain percentage said, yes, they now contact more often. So 12% said they contact more often, but a larger percentage, 18%, said they contact their provider less often. So in terms of physician workload, at worst, it's neutral, and there is some evidence that the workload with the physician may actually improve and decrease. In the next slide, we see that the doctor-patient relationship improves with the note. So did reading the note change the way you felt about your doctor? 37% said yes, and 62% said no change. So 99% either felt better or there was no change about their physician. 1%. So there are some patients that when they read the note, they do feel worse about their doctor. There's anecdotal reports where the patient would say, well, you know, once I read the note, I decided to switch physicians because I wasn't happy with the way I perceived the relationship was going. And then it turns out that those that are older, that are non-white, that have a lower level of education, that are in poorer health, have a higher percentage that feel better about their doctors. So it seems to be more important in basically the medically underserved and the sicker patients. In the next slide, this summarizes our findings. 99% of people are likely to feel the same or better about their doctor, so the relationship seems to improve. And then those that are non-Caucasian in poor health and lower education are more likely to feel better about their doctor. Now, we haven't studied specifically the patients for whom English is a second language, but our sense anecdotally is that it's actually more important for those patients because they have trouble understanding the visit as it is. And having access to the note gives them time to take a look at what happened, what transpired in the visit. And if they have difficulty understanding that, they can often rely on friends or family members to interpret what happened. So for that group, it's actually a bit more important, sort of paradoxically. The next slide yeah, again, 4 out of 5 say the availability of OpenNotes would impact their future choice of providers. And what we hear is patients are grateful for getting access to their notes. In the next slide, we have a number of videos that are on the OpenNotes website that people are free to go and take a look. And this was one of the caregivers whose sister was a Spanish speaker and had difficulty understanding the visit. And so she was able to go in and look at their notes and explain to her sister what was going on. In the next slide, this talks about the informal caregivers, the people that are caring for patients at home, family and friends. Again, 88% of patients and 86% of the informal caregivers had better formulated questions for their doctor, had more productive discussions, had better understanding of their conditions, remembered the patient's care plan, felt more in control of their care, and reported taking medications as prescribed. So this is almost as important to the informal caregivers as it is to the patient itself, and you can see how that would help the overall health of the patient. In the next slide, you know, patients already have the right to their medical record under HIPAA. So they have a right to get a copy of their medical record, to change incorrect information, and to find who has seen their medical record information. The only thing that this does is it allows this access to be easier. So they already have access to the information, but if any of you have tried to access your information by going down to medical records, you understand the difficulty and the problems with trying to do that. In the next slide, originally the electronic health record was really an effort to put information into the medical record so that other physicians could see it and have access to it. But with the electronic health record, this provides the opportunity to give patients access to the note, which is something that without the electronic medical record was very difficult to do in the past. And what we find is that giving patients access to the note really extends the visit. So it's not just a 15-minute visit every 3 months. It's they're able to see the note, understand the note, and interact with the physician if necessary in between those visits, making the relationship really a much longer one than just the 15-minute visit. And overall, what we hear predominantly is it improves the relationship between the physician and patient. And then with that, the next slide, if this was a medication, if we said, hey, here's the medicine that you can take that's going to improve the trust between the patient and the physician, improve their patient engagement, improve patient safety, I mean, this would be a blockbuster medication that the pharmacy companies would be marketing quite a bit. It's not without side effects. You know, a certain percentage of patients may have, you know, confusion side effects, but overall, the benefit of such a medication would be huge, and definitely people would be promoting its use, and that's kind of what we're doing. We're not as good as the pharmaceutical companies, but bit by bit, we're making significant inroads, and more of the country's healthcare organizations are moving to improve this transparency of the medical record and implement open notes. And with the next slide, this kind of just summarizes what we talked about. Patients have a better understanding, feel more in control of their care. They can identify inaccuracies and play a role in the safety of their care. They feel comfortable with accessing the notes, and they can communicate more clearly when they have the note, as well as the experience of having had the visit. So that summarizes what we know about open notes. And in the next slide, I'll turn it over to Amy, who will talk about the dissemination of open notes and particularly address the issue of the safety net population. So Amy?
Hi. Yep, I'm here. Can you guys hear me? Yep. So this slide shows you where we were back in December of 2014, so 4 years ago. Dr. Chen and I are the co-chairs of what we call the Northwest Open Notes Consortium, which my nonprofit helped get going. And in December of 2014, it's when we had in April of 2014 was the first of the Northwest Consortium folks, the Kaiser Permanente Northwest, kind of stepped off the curb, so to speak, and was the first of the consortium to delve into open notes. And then from that, you can see the list in the kind of Oregon and Washington area, where several others followed behind. So from that, at this point, we had 5 million patients who had easy access to notes. The yellow dots that you see are where the VA clinics are, because as many of you probably know, at the VA with the blue button, we consider that open notes, because blue button allows patients easy access to their notes and to download them. And then the purple states are where we knew of open notes implementations. So if you move forward a slide, you will see we now have an interactive map if you go to our myopennotes.org that you can see, and then it will list all of the organizations. But we are now went from 5 million 4 years ago to 33+ million having access to their notes. These are they're in every state in the US now. And you'll see the kind of teal green states, the whole West Coast, and I am so bad at my US geography, I can't remember which states, Wisconsin, and I'm missing the other state. But those are the states that have more than 10 institutions doing open notes. So where there's the most, and those are also states where we have kind of consortium type groups where we have a really targeted effort to spread open notes. You can go to the next slide. This one speaks specifically about kind of your type of clinics that are doing open notes. This was as of September. There might be a couple more now, but these are the ones that we knew about then. So these are either FQHCs, or some of them are academic health centers that, like Bastyr and the National University of Natural Medicine, that have community clinics, sliding scale clinics, as part of their learning process. And then we know of a few that are piloting that haven't quite gone widespread with all of their providers and sites doing OpenNotes yet. Okay, next slide. And this is who we know about. There could be others that we don't know about, but these are the groups that we know about in Nevada who are doing OpenNotes, so not quite as much penetration yet, and that's part of the reason we are really excited to be on this call with you all. Next slide. Here, I don't think we're showing this video today, but
right.
Go ahead.
It just shows you that we do have a video if folks are interested about the non-English speaking patient, and we do have that video on our note site. But because of the WebEx,
so
we should probably skip the video.
Videos are kind of tricky over the WebEx, so we decided not to do that today. But we will show you the slide that shows you where you can download all of the information. Again, at the opennotes.org, there's several different kinds of toolkits to help support you, and all of the various videos that have been made from patient perspective, provider perspective, administrative perspective, to help you through a change management process around it. So specifically talking about vulnerable populations, there's new research that challenges kind of the common assumption about who benefits from electronic health information. I think Dr. Chen spoke a little bit to this, but we're learning that this is a really helpful thing for shared decision making and safety. It's really important, especially to build trust, and especially in populations that have been historically harmed by the medical system and may have lack of trust. Having this level of transparency is very helpful in that. And there are some studies that are in process now, but they aren't quite released, but we will forward them to the Nevada PCA once we have the kind of more vulnerable population studies released, so that they can share those with you. Next slide. So this is a note with permission from one of our colleagues, and you can go ahead and click so that it shows the rest of the slide. So this is our colleague Liz who graciously shared this note, and part of it is people sometimes say, well, why do we need to share the note? You know, we give them this after visit summary thing. This is a kind of what she was given as an after visit summary from her UC Davis health system, which, as you can see, has very little information. It just has her vitals and the diagnoses that were put in the problem list, and not much else. And in a previous life, I worked for about 10 years helping install electronic health records, and I know that many times providers aren't done documenting at the point that the patient has left and the after visit summary is handed to the patient. So that's one reason why sometimes they look blank like this. So Liz shared on the other side of the screen what the actual notes say and how much more meaningful that is. It's the rest of the story, so to say, and that's why patients want this. Next slide. Oh, there you go. So what we're learning from clinicians, and Dr. Chin, feel free to jump in here if you want to speak to this, but is that many expect that there's a large change to workflow, like in the original study that I began with, but we found over and over again with our Northwest Consortium and from what we've heard nationally from other folks that there's very little impact to workflow. Clinicians have concerns that patients will worry or be confused by the note, and again, that is just something that does not seem to be a very large issue. And clinicians report little change in the way they write notes, and those who do, it's mainly around we'll have another slide about this where I'll go into more detail, but just not using abbreviations and acronyms and minor changes to make their notes actually better and help with their documentation overall. Next slide. So here's a few more anecdotes from providers and patients in terms of what they've experienced. So many of the providers, oh, go ahead.
I think predominantly what we hear from providers is it was a non-event. You know, people are worried about this, but when it actually gets implemented, it really was nothing. It's
no big deal.
Similar to, yeah, for those of you that have implemented a direct access to lab results, you know, prior to implementing that, physicians were very concerned, but after they implemented patients accessing the lab results, basically you hear nothing. If anything, patients are grateful for that access, and it's the same thing with notes.
Yep, that's what we hear over and over again as we've had groups come on. And patients report that it makes them feel like they're more part of the care. Again, it's really helpful for the relationship. It means everything to me. I have a serious medical condition. Reading the notes gave me a better understanding of how I was going to get through this. And really, like we said before, providers don't change how they're providing care much. The next slide, we'll talk a little bit more. You can go ahead and advance it on some of the tips that we recommend and that we've heard from providers about how they may slightly change how they document. So some of the things are that we suggest that you do explain to patients what they might expect to see in the notes, that you should expect patients to read, download, and share their notes. So, you know, the note belongs to the patient. If they choose to share it on Facebook or wherever, they may do that. So write notes accordingly that, you know, the patient may share it, or share it with somebody to help them better understand it. Use situational wording to focus discussion on the problem at hand. The planning part is really where the plain language piece is really important in the plan. That's the part that a lot of health literacy folks are concerned about. Will people understand? And really, the plan is the piece that needs to be written in the plain language for understanding. And there's certain language that providers are kind of trained with that it will be interesting as more and more of the academic health centers who seem to have been the early adopters in implementing OpenNotes do so, if how the new providers coming up are trained, whether that will change, because traditionally language like poor historian, patient denies, or non-compliant have been used, and those are kind of not very patient-friendly terms. So these are kind of some of the suggestions. Patient could not recall, patient did not report, patient chooses not to, which are a little bit more patient-centered, patient-empowering. So some of the don't tips are, you know, don't oversimplify the notes. They still have their function as being, you know, a legal, medical, and to be shared between providers type of document. Don't omit sensitive issues such as obesity, substance abuse, mental health, etc. Don't use pejoratives, which hopefully, you know, shouldn't be used anyway, but we know in reality they are by some providers. But quite frankly, this level of transparency helps providers do better in that. And then also being aware about jargon or abbreviations. So things like SOB, which is shortness of breath, may mean something different to the patient and might be found insulting. Next slide. So here is kind of a checklist if you are interested in taking on this OpenNotes initiative, to work on getting agreement from key sponsors or clinicians to move ahead. So kind of figuring out who in your organization would be your champion for this. Talk to your EHR vendors about implementing. It looks like from the poll that most of you are on either NextGen or eClinicalWorks. We know eClinicalWorks we've been working with, and there is a pilot currently So they do have the capability, and you can talk to your technical support person, and Dr. Chin, I believe it's version 11 that has it kind of standard. So you may need to, depending on what version you're on, look at updating to version 11 if it's something that you're wanting to do, but I think there is a way that they can retro it. And NextGen has the capability as well. We are continuing to have conversation with them. NextGen's capability is more at a provider by provider level, and we're encouraging them for it to be at a clinic or organization level so that it could be what we consider an opt-out versus an opt-in, where you make the decision for your whole organization, so the provider would have to opt out of it, where when it's provider by provider, it's a little bit harder to manage an opt-out. But we continue to have conversations with them. We have about monthly or every other month calls with most of the major vendors, including Epic, Cerner, Meditech, Allscripts, and ECW, NextGen, and Athena. And I may be missing one. Organizational communication is important. We have a communication toolkit that will show you how to find it on the next screen. Patient communication, we have posters and handouts available that our OpenNotes team is happy to co-brand with your organization. And then, you know, you're able to print those. People often advertise on their patient portal and letting folks know that they now have access to the notes. And for people who are trying to bring up their kind of for meaningful use, their number of patients on the portal up, what better way than to have something that the patient really wants to read, which is the note about themselves. You can go to the next slide. So this is our OpenNotes.org website, and you'll see under health professionals and then tools and resources, these are the various toolkits that that we have available. And I think we're kind of working on one that's specific to safety net clinics or vulnerable populations. We're pulling together some particular things, especially as these new studies come out for groups such as OCHIN, and that we would share with PCAs and other clinics as well. But this is how you find kind of the various toolkits around implementation, communications, mental health, pediatrics and adolescents, because there's particular issues in general about portal use in those populations, and then, you know, the greater concern to a degree with OpenNotes, although we do have some groups who are sharing notes with their adolescent patients. Caregivers and patient and family advisory councils, which is a way that in many groups the kind of OpenNotes movement has spread within organizations as it's come through the PFACs. And I think our stories, that tab is where most of the videos are. And under Join the Movement is where you can find the interactive map. Next slide. Here are just a few different examples of what we think are nice ways that different groups have kind of advertised finding the note on their portals to just draw attention to it. So you'll kind of see where the red circles are highlighted, you know, how different ways that they've done that. In the Kaiser example where it's circled, they had like a little video. You know, sometimes when vendors do an upgrade, the way the navigation in the portal changes, and we had an experience where a vendor did that and then it became a little bit trickier to find. So then this group made a video to help people find their notes. So yeah, next slide, and we can go back in the questions. I'm not sure if people are typing in questions as you have them. We're nearing the end of our talk here if people have questions. And this is just kind of reiterating the case for OpenNotes. It increases patient involvement and understanding of their care, increases trust in their provider, which I think particularly with FQHCs is a really big important thing for patient engagement. It's not extra work. It's better communication with the patient and their family. and caregivers. And it's more important for medically underserved people with poor health or chronic conditions or English as a second language, and helps with patient safety. And I think the final slide is the next one. So, Dr. Chen, do you have anything else to add before we open it up for questions?
No, I think that's it. I think this last slide sort of embodies what this is about, is getting patients and clinicians to be on the same page, to engage better, and to be more partners in care as opposed to sort of having a paternalistic approach. So that's fundamentally what this is all about. And there is a video here that if you go to the website, you can see as well.
Well, thank you, Dr. Chen and Amy, and thank you to everyone for attending today's webinar. If you have any further questions, contact me at, like I said before, bjohns@mvpca.org or 775-887-0417. Once you leave today's webinar, you'll receive a survey on the presentation, and we'd appreciate if you complete that and provide your feedback. On behalf of Nevada Primary Care Association, thank you for joining us today, and have a great rest of your day. Oh, I see a question. Oh, I have a couple of questions coming in all of a sudden.
Okay.
We're still here.
Okay. I'm not sure. So your name, Athene Barton?
Oh, Ithne. This is Ithne Barton. I'm the Chief Medical Officer here at Community Health Alliance. And I just have a quick question. We have an EMR called MicroMD, and I don't know if you have any experience with that. I know it wasn't mentioned in the ones that you talked about.
Can you repeat the name of it again?
Sure, MicroMD.
Yeah.
MicroMD.
Yeah, we do not. You know, there are many vendors. We've sort of tackled the top 10 vendors. But what I would suggest is to talk to your vendor and say, hey, this is something that we're interested in doing. With some vendors, it's a lot easier to implement this than with some others, and it's just a matter of starting to talk with your vendor to see what the possibilities are.
And we're happy.
We're happy to be engaged too.
Cool. Thank you. I will start there.
Yeah, but we have not specifically talked to MicroMD.
It's a smaller EMR, so I didn't expect that you had.
We have one more question from Steve Flores.
Can you hear me?
There you go. Yep.
Yeah. Looking at implementation, from the time somebody decides they would want to do this, because my staff and I have discussed patient portals. We're on ECW. So what kind of setup, training, working with ECW are we looking at in terms of time frames?
Are you on version 11? I
Yes.
guess would be. Okay, you're already on version 11, so that helps, and I'll let Dr. Chen answer the other pieces.
Yeah, it shouldn't take a lot of work. The only thing about ECW is when they do open up the note, my understanding is that their setup right now opens up all the notes from the first date of implementation of ECW, and some of the organizations are really a little reluctant to do that. They would like to open up the notes from a particular day, like if you decided to do it today, to give the physicians advance notice that, hey, we're going to open the notes from today, but the notes from before today are still not going to be available. So we're working with ECW on implementing that functionality. I'm just not sure that they're there yet, but the first thing would be to talk to the ECW representative and say, hey, we're interested in open notes. They have been advertising that they are able to support open notes out of the box. And so I would talk to them and say, hey, you know, how do we do this? And move forward. In terms of education, the predominant thing is educating the providers to let them know that their notes will be available and can be viewed by patients. And then there's that one slide of do's and don'ts that you might want to pass out. But the amount of prep work is not huge, and it won't frankly take a huge amount of effort. As we said before, the predominant response from physicians is it was a non-event. So if you
Okay,
turned
good.
on labs, the process would be very similar, is to educate clinicians, give them that one pager, and then implement.
Okay. Well, we have ECW
Yeah.
to our center in March. They'll be there for 3 days for training. So actually, that would be a good time then to talk to them about it, as well as once we get the slide from Brandy, I'll share it with my staff next week.
Yeah, if you're in the process of implementing ECW, then that's a logical time. Or if you're in the process of implementing the portal, then that would be a logical time to say we're going to do the portal, and as part of the portal, we're going to include not only the lab results but the notes.
Okay. Yeah, and we've been on ECW for about 4 years now, and we're just discussing the portals. We're just at a point where we should be ready to do that.
That'd be great.
Yeah,
If you
please
need
let us
that's
know how to,
basic
yeah. We're both eager to help you.
All right.
And Steve, I can share contacts with you as well.
Say that again. I didn't hear what you said.
I just said that I'm willing to share their contact information with you as well in case you need to reach out to Dr. Chen or Amy.
Okay, perfect. I appreciate that. That would be great.
Any other questions?
I don't know. I was going to share one thing. I think it may still kind of be in process, but our understanding is your HRSA region, is it region 9?
Yes, correct.
Yes, and that the California PCA is hosting this year some kind of conference. I know that we put in our colleague who lives in California and co-chairs the California OpenNotes Consortium, put in to do a panel presentation on OpenNotes for the Region 9 HRSA conference, which I can't recall exactly when it is, I think in the spring. So there may be a presentation there as well, just if you have staff who go to that, just a FYI.
Great, thank you. Well, thank you all for joining us, and thank you again to Dr. Chen and Amy.